have Davao doctors.
Meralco, we have people from the Power Group. And then
invited Pacific Global one too.
Yeah, great.
So hi everyone, good morning. So we just have a quick poll. Just wanted to know where everyone is coming from while we're waiting for the rest of the attendees to log on and join us for this call. And we're also encouraging everyone to sort of say hi in the chat. Let us know where you're from, which organization you're part of, just so we can get to know each other a bit better. It's not a replacement for in-person interaction, but it's the best you can do under these circumstances. So we'd love to know where everyone is coming from. And then we'll just send a few reminders to everyone over on the chat so that we can really make the most out of this meeting.
Shall we start, Denise?
Yes, sure. So Hi, good morning, everyone, and welcome to Innovation Morning. So this is the first for the year. It also happens to be the first online edition of Innovation Mornings that we're running with IdeaSpace. So for the folks who are new to IdeaSpace and who are maybe joining Innovation Mornings for the first time, just wanted to give a brief introduction on what IdeaSpace is and what we do. So IdeaSpace is a nonprofit organization promoting technology development, innovation, and entrepreneurship. We've been operating since 2012, and we have four flagship programs. So the first is an accelerator program. So every year we run a national startup competition where we get basically the best tech startups, young, pretty early stage, and they go through our boot camp, a pre-acceleration program, and then an acceleration program where they get access to training, mentors, and different resources to help them really build and grow their business. And then once they graduate from that program, they enter our alumni engagement program where they get access to, well, in the time before COVID, it was access to office space, but they also get access to mentors and training because we're part of the Google for Startups network. So we get to help them as they continue to build, grow, and scale their businesses. And then we also have the Opportunity Fund, which is our way of investing in startups within or outside of the IdeaSpace network. And then lastly, we have the External Relations team, where we handle both donor engagement and then also marketing communications. And then for Innovation Mornings, we're actually planning a couple of talks after this. So we have a couple of categories that we're focusing on. The first is the future of. So it's really starting to think about future of industries, what the world could be like, not just with the whole COVID-19 pandemic, but just starting to think about how industries can evolve and maybe talking about different signals, trends, or developments that are already showcasing what the future could be like. And then the second category is what we call a conversation with. So these are basically fireside chats with leaders within or outside of the Metro Pacific Group. And then the last category, which we'll hope to do as well for the Innovation Mornings in the future, is on the news. So it's really ripped off the headlines kinds of topics that impact the donor companies or the Metro Pacific companies and the IdeaSpace startups. So to give his opening remarks, we want to welcome the IdeaSpace president, also president of Kubo Innovation Hub and the Philippine Disaster Resilience Foundation, Mr. Butch Maley.
Yeah. Hi, everyone. Yesterday, I attended a series of meetings on increasing the PCR testing for the country. And I have to say that the Metro Pacific Group of hospitals really took the lead, no, in terms of committing to ramping up PCR testing for the COVID virus at many of their hospitals. We're the only group that really can do it because we've got a nationwide group, and the government is really relying on us to help because their testing capabilities right now are relatively low. And in order for us to reopen the economy, we really need more data. And that's what they need in order to make an intelligent decision on when we can reopen the country, particularly Metro Manila. And another token of this leadership is really what's happening today, because the mere fact that this IdeaSpace Innovation Morning is happening is a real tribute to the IdeaSpace team, to Diane, to Eunice, and to everyone else. It's just a big deal that we're able to do this. And I also noticed that the attendance has increased, and perhaps we'll be doing more virtual meetings in the future as we move along. These startups are continuing to function, especially the ones that are online. We've got online grocery delivery services, Metro Mart, Pushcart, Sagana, Brookie, a number of those. Also the online learning platforms such as Front Learners, IOL, LearnTalk. These are also thriving. So I think it's important for everyone to just communicate and be active. There are a few things we don't know, quite a few things we don't know. Many unanswered questions about the COVID crisis, but there are a few things we do know: that life will come back at some point, that our businesses will continue, and that the Metro Pacific PLDT Group will continue to be one of the preeminent organizations in the country. And I'm proud to be part of it. I'm proud to be one of your colleagues, and I'm proud to be part of the IdeaSpace team. Thanks.
All right, thank you, Sir Butch. So thank you everyone again for joining us this morning. So I'll give a brief introduction of our speaker for this morning's Innovation Mornings event. So our speaker this morning is Dr. Renzo Guinto. Renzo is the Chief Planetary Doctor of PH Lab, which is a global think and do tank for generating innovative solutions that advance the health of both people and planet. So Renzo is an Obama Foundation Asia Pacific leader and also an Aspen Institute New Voices fellow. And he recently completed or finished his Doctor of Public Health degree at Harvard University. For his doctoral dissertation, he investigated the concept of climate-smart health systems in coastal municipalities in the Philippines. Renzo is the youngest member of the editorial advisory board of the Lancet Planetary Health, the world's first planetary health journal. He's also a co-founder of the Emerging Scholars Network of the Planetary Health Alliance, which is headquartered at Harvard University, and he is an advisor to the Forum on Climate Change and Health of the World Innovation Summit for Health, which is based in Qatar. So without further ado, let us all welcome Dr. Renzo Guinto. So take it away, Renzo.
Thank you very much, Eunice, and thank you, Butch, and thank you, Diane, and thank you to the community for this opportunity. Let me just show to you my slides. Can you see it now, Eunice?
Yes.
Awesome. So for the next couple of minutes, I am going to talk about this term planetary health, which probably many of you are hearing for the first time. And I'm not here to give you a gloom and doom news or prophecy of the future, but hopefully in the next few minutes, we gain a better understanding of what really is happening in the world right now with COVID and beyond, but also take this opportunity to, reimagine, recreate what, the future might look like post-COVID. And that's why there in the title, I said, our compass for our post-COVID future. It's great to be back here in the Philippines, but unfortunately, I came back just shortly before COVID erupted and showed up in Wuhan. And now we are having this crisis, around 3 million people already affected globally. And I'm back because I am establishing this PH Lab. PH, later I'll talk about what PH means. I already gave one, Planetary Health. But it is a new organization that I am envisioning and establishing, which will characterize these three dualities. It's global in perspective, but local in impact, or glo-cal rather. It's a think and do tank. There are a lot of think tanks in the world already doing a lot of the thinking, but very few are doing the doing. And so I want to make sure that ideas are really translated and they impact real lives and real communities. And finally, it's for people and planet. And that is what planetary health is all about. This integrated view that the health of the people and the health of the planet are deeply intertwined and in fact inseparable. And I'm really excited to be talking to a lot of the smart people here, innovators, entrepreneurs, maybe some investors or donors. And after this, I would love to hear how we can work together and collaborate to build PH Lab and to spread planetary, I'll just borrow the virus metaphor, the positive virus of planetary health within the Philippines and across the world. And really, my theory of change when it comes to building PH Lab, but also when it comes to advancing planetary health, I came up with a formula, an equation, 3D for PH cube. And it may sound mathematical, but 3D really means, proper diagnosis of problems, creative design of solutions, and actual delivery, execution to generate results and impact. And hopefully with this 3D approach, we address 3 PHs. That's why it's PH cube. And you already know what that one of them is planetary health. And usually I give this as a quiz when I give lectures. The other two are public health, the health of people, and Philippine health, or just the Philippines. That's the nickname of the Philippines PH. So again, this is an invitation to all of you. I'm pretty sure that when you saw the title of the presentation, Planetary Health and COVID, maybe the first thing that came to your mind is the coronavirus pandemic linked to climate change. And it's not an easy answer, yes or no, but definitely there are connections that can be made. And this is another invitation. Last week, I wrote this in Rappler. In celebration of the 50th anniversary of Earth Day, I tried to crystallize in one piece how climate change or environment in general is linked to the issue of COVID that we're facing today. And I will do a brief rundown of these interconnections. So first is that the coronavirus we know that it came from the environment. And the planet's health, the environment's health, is really essential to preventing infectious diseases or the lack of health in the environment provides the breeding ground for the generation and the emergence of new infectious diseases, but also the re-emergence of old infectious diseases. As you can see in that article, even Zika, if you remember, in around 2-3 years ago, there was this disease that was spreading in Brazil, in the Caribbean, leading to congenital anomalies in children. That's Zika, and then Ebola, of course, that hit West Africa in 2014. And we were already very afraid of Ebola, and then COVID comes to our doorsteps in a very insidious manner. When it comes to environment and infectious diseases, you've heard about the potential origins of COVID. It might have come from bats, which was then transmitted by pangolins and snakes and all these other wild animals. And this is just one example of how, the environment and the current epidemic are linked. Because of our human activities, we're consuming still a lot of wildlife for medicine, for food, for many different purposes. Because of rapid urbanization that encroaches into natural ecosystems, forests, for example, the connection or the interface between animals and humans are becoming tighter. There's more interaction, and therefore the transfer of infections from animals to humans become more likely. And in medicine and veterinary medicine, we call it zoonosis. So you might, that's maybe another term that just got added to your vocabulary in the past few weeks. But zoonosis are diseases coming from animals transferred to humans, and COVID is a quintessential example. And so, what happens in the environment can lead to a global pandemic, just like what we're seeing now. This is just an illustration of how, one invisible and tiny entity, it's not even a microorganism, like a virus, can devastate, disrupt, if not destroy, human societies and economies in, through a pandemic. How is COVID and the environment related? As I've said a while ago in my Rappler article, another way that they are linked is not just when it comes to the virus itself, but also in the way we respond to the pandemic. And now we in the environmental field are becoming a bit concerned about the current response, the actions that we're doing. And for sure, environmental considerations may not be top of mind during the early phase when we're still trying to, understand the situation and grapple with the solutions. But we're already past the first month, and therefore now we're calling for a more environmentally conscious approach to addressing COVID. As you can see, it might be generating a new kind of pollution with all the masks and PPEs floating in the ocean. Another link between COVID and climate change and the environment is, these reports that the environment has become cleaner as a result of the economic shutdown and the societal lockdown. This is, for example, just one report showing air pollution in China has been dramatically reduced because coal power plants have been shut down because factories are not operating. And then here in Metro Manila, people are taking photos from their condominiums that, the mountains in Rizal can already be seen because the air was cleared, blue skies emerged. And I would like to give a word of caution. In fact, I remember there was even an article saying that dolphins even showed up in the Venice canals. Apparently, they're fake news. But there's a lot of excitement about the environmental benefits of the pandemic and the response. But I would want to caution that this mirage, this illusion of environmental benefits should be taken with a grain of salt. One, we're not sure if we're going to sustain these gains in environmental protection, especially if we just end up going back to our old habits when we transition to the post-COVID world. That's one. But number two, it's showing to us that if we do not do decarbonization, cleaning of the environment in a gradual and intentional manner, such as in the form of a pandemic, then people's lives will be at risk. Economies will be bankrupt or disrupted. Societies will be in great suffering and pain, and we don't want that. And so we're given this wake-up call that if we prepare and really plan our transition to green economies properly, then we can avoid all these unintended consequences and spillover effects. So I really like this illustration. I know that you've all become masters of flattening the curve after being bombarded with this, similarly looking graph in Facebook. But this is also another curve that we need to flatten, which is the curve of our environmental footprint, our ecological, our greenhouse emissions, for example. And because we've already exceeded, or we're close to exceeding the Earth's capacity, and we know the risks that are entailed when we destroy our planet. And so, again, this is very interesting. And this is another interesting caricature. Doctors are already, in the post-COVID world, the doctors are already wiping their hands and feeling a sigh of relief. At last, we've already conquered COVID-19, but behind them is a much bigger curve, just waiting, just looming in the future. And you can see sea level rise in overlay in the curve. So climate change and all these forms of environmental degradation will surely, if unmitigated, will be presenting new health challenges, and I will be touching on them in a short while. So who is our patient now? And people are wondering, Renzo, you're a physician, and then you did a doctorate in public health, but why are you talking about the planet? Because really the patient now is not just people, not just humanity, but also the planet where we thrive, which we also destroy in exchange of our for temporary convenience and our luxuries. And so we really need Arundhati Roy, the great Indian author, said that the pandemic is a portal. It's a gateway between one world and the next. But we need a new compass when we enter that new door, that new gateway. And that is why my proposal is that planetary health is the compass that we need. This is the report, the seminal report in 2015 that introduced the concept of planetary health. It's a new discipline for the new normal. And let me define it to you just briefly. It refers to the health of human civilization and the state of natural systems on which it depends. So if you notice, we're not just talking about health of people. We're now talking about health of people plus planet. And that is the main difference between planetary health and the older concept of public health or human medicine, which again is only concerned about humanity, about treating human patients, and putting aside environmental considerations. And what happened actually is for the past century, we've added around 30 years to the average life expectancy of the world, but at the expense of the planet. We've built economies that put food on the table, that give jobs, healthcare systems that treat people's illnesses. But really, these are also systems that emit carbon, that pollute water, and destroy forests. And so now, we are given a new opportunity to have a more integrated view that looks at both the health of the people and health of the planet. It's also the international and interdisciplinary field focused on characterizing and addressing human health impacts of global environmental change. Next slide. Here, I'll not go into detail, but it shows to you one key term there is anthropogenic. Anthropogenic means human-made. And a lot of the health problems actually that we face in this century are in one way or another induced by ourselves to ourselves. A lot of the diseases that emanate from the environment, it's because we've disrupted forests. And we've warmed the planet, leading to coral bleaching, leading to declines in fish stocks, leading to protein deficiency in many parts of the world. And so, we can list down a lot of the health problems and be able to trace them back to environmental factors, but also to social factors, social activities, economic factors, culture, even the technology that we generate, and also the failures of our governance systems. They all create the conditions for planetary health problems and diseases to emerge. So, next. And these are just some examples of numbers. If you're already scared about 3 million people having COVID and I think around 500,000 people having or dying or less than that rather, these are the numbers that are just waiting to emerge, to manifest if we will not address the planetary health challenges head on and sooner. I'm not going to detail, and these are all gross underestimates because there's always the factor of uncertainty. We don't know what might happen. No, we knew that an infectious disease pandemic like COVID will be happening in this century, but we didn't know that it's going to happen in 2020. So it's really, it urges us to emphasize prevention and vigilance. And also redesigning basically society and reorienting the way we view health. Planetary health, there's a lot of debate. Is it a field? Is it a policy framework? Is it a new moral imperative? Is it a new scientific paradigm? Is it a communication strategy? I think they're all of these. And I think for entrepreneurs, innovators, business folks like you guys, planetary health can also be a new frame for the in terms of the way of doing business, especially in the post-COVID world. And later we can talk more about how this applies to business and enterprises. Planetary health challenges, according to the 2015 report that I mentioned, are characterized by three main qualities or features. The first one is conceptual and empathy failures, or what they also call imagination challenges. It's just very hard to imagine how an occurrence or a phenomenon in the stratosphere affects health outcomes tens of thousands of miles below. Okay, it's just if you draw a causal chain, A leads to B, leads to C, leads to D, leads to E. It's just a long one and it's a complicated one. And that is why people grapple with planetary health challenges. And that's why we need to address the second set of failures, knowledge failures, research and information challenges. It's an invitation to go out of the box in terms of understanding these problems. The old ways of doing research in medicine are not necessarily the best ways of understanding complex and multifactorial planetary health problems. And then the third one is implementation failures, or what they also call governance challenges. The design of our economies, the configuration of our governments, they're just not compatible anymore with the magnitude, the scale, and the urgency of planetary health problems that we face. And now we're seeing a sneak preview of that with COVID. What is happening now is really a lot of iteration and innovation. Private sector stepping up and building their own coalitions and networks. Ways of doing things outside of what the bureaucracy has taught them. And even in the international community, they are also building new modalities of working together across boundaries and across sectors. So this is another important framework in the planetary health field, which is called the Planetary Boundaries Framework. It was developed by colleagues at the Stockholm Resilience Center. And basically the thesis of this framework is that there are 9 planetary boundaries. And as you can see, there are already 2 boundaries in red. Once these boundaries have been violated, have been breached, then human survival is not anymore possible on Earth. Life on Earth is not anymore possible. And as you can see, there are already 2 in red. Those are the boundaries that we've already violated. Biosphere integrity, because for the past century, we've seen the fastest rate of extinction of creatures great and small globally. And then biogeochemical flows, usually I ask this as a quiz, what's P, what's N, what are these elements in the periodic table? That's phosphorus, that's nitrogen. And these 2 elements have already been altered at a great scale. You know, the natural flow of these 2 elements have already been disrupted because of our addiction to artificial fertilizers in the agricultural sector. So these are 2 boundaries. 2 out of 9 have already been violated. And as you can see, there are more to come, unfortunately. And we know that in the 2015 Paris Agreement, we've already said we can't go beyond a 2 degrees Celsius increase in global average temperature. So we're approaching that mark, that limit. And of course, that will have grave consequences to human life on Earth. Okay. So I already mentioned about climate change. You will see all these headlines from, newspapers and magazines. We live, the Philippines, we Filipinos live in the hotspot for climate change. And Southeast Asia in general is definitely vulnerable. Here you will see in the map, the redder your country is, the higher your vulnerability to climate change and its effects is. And which country is that? Of course, our beloved PH, the Philippines. So we're really at the heart of this crisis that is slow burn and long term. So here in another ranking, I think this is the Climate Risk Index by the German Climate Watch. We're number 2 in that index, in that ranking. I always say the Philippines is always top-notchers in boxing and Miss Universe, but we're also unfortunately top-notchers in climate vulnerability and disaster risk. We're usually 1 or 2 or, one of the top 5. And as you can see, our typhoons, our hurricanes are becoming greater intensity and scale and number. And this is Typhoon Haiyan in 2013. It almost enveloped the whole archipelago, as you can see in this map. And what happens when climate-related extreme weather events strike, like a typhoon, food, water, shelter, educational systems, even health systems and hospitals are disrupted, if not destroyed. I remember in Typhoon Haiyan, even health workers couldn't report to health facilities, to their barangay health centers, because they were victims themselves. And then it just, this COVID-19, I think, gives me a bit of a flashback, because the country, the Philippines, also has the highest rate of mortality of health workers fighting this coronavirus pandemic. So, and of course, in the Inquirer, it says there the following day, it's the worst disaster to hit PH. And as you know, PH already, as you already know, PH means different things to me. It's the Philippines, it's public health, it's planetary health. Here, and I'm, pulling it from my doctoral dissertation, just to show to you how climate change affects the health of Filipinos. There are already reports about the effects of climate change on health in other countries globally, but specifically in the Philippines. You can just look at the bottom part of the map of this diagram. Nutritional gains will be reversed. Mosquito-borne diseases are expected to further rise. But also there are anticipated challenges like mental health stress resulting from increasing exposure to heat, or hypertension as a result of intake of highly salinized water. And I have a slide on that shortly. I mentioned already mosquito-borne diseases like dengue. So I don't know how COVID is going to change the dengue profile, but I mentioned about seawater being high in salt, and that is what's happening now in many coastal communities around the world, where sea level is rising, seawater is intruding into the drinking water, into the groundwater, and people are drinking water high in salt. And we know that high salt diet leads to hypertension. And in Bangladesh, we're already seeing hypertension increase among people who drink water high in salt. And this is a problem that is also looming here in the Philippines, 5 times the rate of sea level rise. We can find that here in Philippine coastlines. And what happens when the level of the sea rises in an untenable way, islands disappear and people have to move. And here you will see that, you know, I don't like the word climate refugees because refugees flee away from persecutorial governments. But here people are running away from environmental phenomenon that is induced by humanity because of our addiction to greenhouse gas carbon emissions. So people are moving. Islands in the Pacific are already scouting for places to move to, planning to buy land in Australia, and human migration will be intensified more than ever before. Another planetary health challenge. So a while ago we talked about infectious diseases, but also non-communicable diseases, diseases that you can't, transfer or contract, with a virus or a bacteria, like obesity, heart disease. These are diseases that are also linked with the environmental challenges that we face today. There's a new report, they called it the global syndemic. It's a confluence of epidemics of obesity on one hand. 1 billion people on Earth are overweight and obese, over-consuming. But on the other hand, there's also 1 billion people on Earth undernourished, under-consuming, and you have climate change that is generated by, of course, many different sectors, but also by the agricultural sector because of our large-scale agricultural practices that emit a lot of carbon, use a lot of water, land, and energy, and basically destroy the planet. So it's, again, a looming crisis in the future. It might not be as devastating and catastrophic and dramatic as COVID, but it's slow burn and subtle, but it will lead to deaths worldwide if not addressed. And that is why last year there was this report that came up with this new proposal, a planetary health diet, a kind of diet that is both good for people's health and nutrition, but also good for the planet because it's low carbon and not water, energy, and land intensive. So as you can see here, our meat is just a very small portion of the plate. And I think if you translate that into a week-long diet, it's just going to be a single serving for an entire week. And it's going to be a very interesting conversation. How can we apply it in meat-eating and meat-loving countries like ours? We can talk more about that in a bit. And then finally, another example of a planetary health challenge. People don't talk a lot about it because, again, it's subtle. It's not as dramatic as, what I mentioned to you a while ago, antimicrobial resistance. As you can see, by 2050, around 10 million people are expected to die because of antimicrobial resistance. And what is AMR? There will come a time when our antibiotics are not anymore going to work, to function, because your bacteria, your microbes have already become resistant to these antibiotics. And this is a problem because, number one, if I am a surgeon, I would rather not operate on you because you will probably die faster of the infection. as opposed to die of, let's say, the tumor. So that's going to be a public health crisis in the future if our antibiotics are not anymore working. And I think in some parts of the world, there were already findings that there are some strains of tuberculosis that are not just multi-drug resistant, but resistant to any drug at all. And that is concerning because Philippines, for example, we haven't really eliminated tuberculosis yet, which is a disease of poverty. And what is the reason why we have AMR? Of course, physicians and even ordinary people have been using antibiotics left and right in a non-judicious manner. But around 75% of misuse of antibiotics is coming from the livestock poultry industry. We've been pumping our animals, our domesticated animals, with antibiotics as if they're vitamins. And now we are seeing bugs that are mutant and better and stronger and more resistant to these antibiotics. And so when we use the medicine for humans, they're not anymore working because the resistance already developed in the chicken that we later consume. So again, this is not just a medical issue. This is a social economic issue. We need to work with the food sector in addressing this as well. So in my last few slides, given the challenges that I talked to you, and I hope I did not cause any panic or fear among our audience today, but this is an opportunity to really reimagine health in the post-COVID world. This is Arundhati Roy said it's a portal. Another person said it's a critical juncture where unthinkable reforms can now be talked about because we are in basically a global societal pause. Just a reminder that health is not produced inside the hospital. Health is produced elsewhere. As you can see, 55%, this is just an estimate, in the social and environmental factors. Behavioral factors, 20%. So there's a role for advertising and media to really shape good behaviors, healthy behaviors among our public. And we doctors are actually close to being useless in terms of health creation because we are merely focused on the business of illness or disease management and treatment, not the creation of health. And that is why I love talking to very broad audiences because, again, that's where we can maximize the potential for creating health in this century. I talk about the planetary boundaries, but people are asking, is it just about the planetary limits that we need to be considering? And so this economist, and she's a female economist, I want to acknowledge that, Kate Raworth, developed this concept of the doughnut economy. And basically, as you can see, it looks like a donut. We met in Oxford 2 years ago, and she was apologizing to me, Dr. Renzo, I apologize for using the donut as a metaphor. I know it's unhealthy. And I said, perhaps this is the healthiest donut that has ever been baked. And right now I'm thinking on how to Philippinize this. Maybe we can turn it into a sapin-sapin economy. Basically what it shows to you is that we cannot exceed the ecological ceiling, the planetary boundaries. But we need to make sure that we are meeting the social foundation, the basic human needs of water, energy, food, health, etc., all those listed in the inner circle of the donut. And that donut is what she calls the safe and just space for humanity. So again, I invite you to look into this book. I think this is should be a required reading, not just for doctors and environmentalists, but for all professionals, including entrepreneurs and innovators. And there was even a study in 2018 by the University of Leeds. They used the donut economy as a rubric to assess which countries in the world are close to becoming donut countries, okay? And usually I give this as a quiz as well. You will see that the first one is, guess which country is the first one. That country has exceeded the boundaries already, okay? But they've also achieved the social foundation. You can see that the blue is almost covered. That's the United States. We don't want to be that kind of country. Okay? In the middle, you will see a country that has not exceeded the boundaries yet. Okay? But as you can see in the middle, there's a lot of social needs that have not yet been met because of the white spaces that you can see. And that's actually the Philippines. So good news, so far we haven't really breached the boundaries, although we have lots of environmental issues domestically. But in terms of the social foundation, we've got lots to do. Health, water access, housing, political inclusion, etc. And then on the right side, you will see a country that has only breached one boundary, and that's CO2 emissions, that's climate change. But basically, in terms of the social foundation, they're close to achieving almost all of them. And according to this report, this is the closest to the donut, at least statistically, and that is Vietnam, which is very close to us. So it will be interesting to see the Vietnam model. Of course, it's not a justification for a more socialist kind of political arrangement. But I think there are lessons that can be learned from Vietnam, especially when even in COVID, I think in Vietnam, if I'm not mistaken, at the last time I saw, they still have 0 casualties, and they're doing a good job for a not so rich country in addressing COVID. And so we need this shift from this limitless economic growth mindset, which is an illusion, and move towards this concept of the doughnut economy that is, again, the best economic model to promote and protect planetary health. Ecology and economy, if you notice, they share the same, Greek first part, eco or oikos, which means home. And unfortunately, we view the economy without taking into account the ecology that powers the economy because of the power from the sun, because of the natural ecosystem services. So now it's an invitation to expand that economic box. And when we design the future economy, we should make sure the ecology is part of it and not a mere externality in economic terms, and not just a CSR, subject. In the academic community, there's also a sea change that is happening, a lot of interdisciplinary work, doctors and veterinarians and climatologists and designers and sociologists working together to really imagine the future that we want. Health systems need to change, and I'll not go into detail. This is just a sneak preview. We can have longer sessions in the future. The future of the health system should be universal, and we know we have a universal healthcare law in the country that still needs to be implemented, by the way. But we need to make sure healthcare is also high value. You can have universal healthcare, but it's low quality healthcare, and we don't want that for people. But also healthcare should be climate smart, meaning it's adapted to climate change because of the effects that I showed to you a while ago, but it's also low carbon. We don't want healthcare to be complicit to the ecological crisis that produces the patients that we see in the clinic and the ER. And finally, we should, and this is an addition actually to my framework, we need health systems that are pandemic resistant. And obviously what we're seeing now, not just in the Philippines, but globally, our health systems are never prepared for a pandemic as big as this. We need workplaces for planetary health. And maybe, now we're seeing the webinarization of activities in the workplace, such as this one. But when we go back to our workplaces, we need to start rethinking about workplaces that are good for our health and good for the planet's health. And this is an amazing work of one of my colleagues at Harvard, this concept of a healthy building. How can we turn our sick buildings into healthy buildings? I would love to bring that concept here in the Philippines. This is an article from yesterday. COVID is a dress rehearsal for entrepreneurial approaches to climate change, to planetary health. And this is another framework that I want to bring to the country. how do we build a culture of health in business, which I call a planetary health-oriented business? Of course, we start with employee health, but it cannot just be about providing health insurance packages to our employees. That's just the tip of the iceberg. Consumer health, consumers, especially in the post-COVID world, will be demanding for healthier and more sustainable products and services. So how are we actually incorporating this into our business strategy? Community health. Businesses are not isolated from the communities where they are located. And so how can businesses contribute better, not just in, organizing a med mission, for example, but really investing in building healthy communities. And finally, environmental health. I'm sure you've already imbibed that throughout my presentation. How do we think about the environmental impact of our products and services throughout the entire life cycle? Even from the point, even before that, when we source our supplies from suppliers, but also until the consumers dispose of, the waste that is generated by our products. In fact, in a cradle-to-cradle economy, not a cradle-to-grave, nothing should be wasted. Okay. And, I'm talking to the innovation community. It's an invitation to think about, this is a term I'm coming up, I should write about it, planetary health innovation. And they can be in the form of a product innovation or data innovation or social innovation, a policy innovation, or an ecosystem-wide innovation that will lead us closer to becoming a donut. This is my dream. People are asking, why are you returning from Harvard to the Philippines when, the Bay Area is waiting for you, Facebook, all these big companies, etc. I think that the Silicon Valley of planetary health is the Philippines. We should be the Silicon Valley of planetary health. And I hope that, with the creative energy that is represented in this group, in this audience, you can help me realize the turning of our country into the Silicon Valley of planetary health innovation. We want to teach the world, of course, address our own problems, but also to teach and show to the world how planetary health can be advanced in the post-COVID world. So thank you very much for this opportunity. Let's advance the health of people and planet together. Let's be planetary healers. And these are my contact details. If I know I already overwhelmed you with a lot of information, but that's just the tip of the iceberg. So looking forward to engaging with you in the near future. Thanks.
All right, thank you, Renzo. So I guess we'll proceed with the Q&A session. We already have at least one question, so I guess we should start with that. So Ben was asking, is the planetary health diet healthier for people too? And if so, why?
Right. As I've mentioned, the planetary health diet was, developed taking into account a huge wealth of evidence, both from the health side and the environmental side. So I invite you to Google planetary health diet, and you will see they've created very specific recommendations. How much of the vegetables should be on your plate? How much should be? And that is why, as you can see, meat protein occupies a very little space in that plate, because one, it's actually not the healthiest source of protein. Sure, it's a source of protein, but it's also causing us, colon cancer, for example. But number two, meat production is very carbon intensive, and there are other sources of protein that are less carbon intensive. So yes, this diet already took into account nutritional as well as environmental considerations. The challenge is how to implement this, because this is not just about coming up with a cookbook or starting a restaurant. It's a cultural change that needs to happen, and the food sector will need to change as well.
I think earlier when you were talking about which countries were close to the closest to the donut, and you were talking about how Vietnam is the country that's closest to the donut. If you also take a look at their diet, it's also pretty high in
Correct.
terms of vegetables. So that's probably one of the reasons why they've been able to limit their own impact.
Mm.
So we wanted to check with the attendees if you have any other questions that you'd like to ask Renzo while he's here. We're encouraging you to take advantage of the opportunity.
I hope they didn't get scared because of the sea level rise. And
But I guess I asked that question na rin. We started talking about planetary health diet and looking into uh, health creation, not just from the perspective of, say, our healthcare workers or
right.
from our climatologists or environmentalists. What else can business be doing to really play a role in terms of health creation?
Right. Um, so a while ago, I showed to you a framework, and I can give a 3-day workshop on how to build a culture of health in business. There are, American businesses have already been adopting this concept, and I hope to bring it to the Philippines and Asia as well. We need more case studies of businesses that really invested in all these 4 quadrants of the culture of health framework. So that's one. There are things that can be done within the company. Interestingly, I'll just give you a statistic, and I'm sure our businesses represented here will be resonant to them. In one Harvard study of Fortune 500 companies, around 79 or 75% of companies have made an environmental strategy. I'm sure you all have sustainability plans or strategies, but only 9% have a health strategy. And that is not just, alarming and surprising. I think we're missing out something very important. And I think COVID-19 is giving us the narrative for positioning health as central to business and not just, again, a peripheral dimension. So that's one. But also this other slide that I showed to you, I remember when I was in Kubo last year, I got to interact with a lot of really excited young entrepreneurs dealing with fintech and what do you call that? Education or tourism, etc. A lot of different industries. There's a tendency for us to Uberize everything. And then I talk about planetary health challenges, and they're like, we've never heard of these problems. And that is an invitation. I think, and I hope that the gaze of the innovation and entrepreneurship community will, be expanded to see all these other problems that remain unsolved and problems that really are a matter of life or death for people and planet. So this is an invitation. I hope your brain cells are already firing up from this lecture.
And we have a question from Celine from Cardinal Santos Medical Center. Her question is, how can healthcare industries help support the society or the community as we adapt to the post-COVID era?
Great question. And, right now, I think the health sector is enjoying, if we're not enjoying, of course, what's happening now, but we are enjoying this huge level of attention, that we've never been given before, and so much respect for our health workers. And so the health sector can capitalize on this moment to really convey a message of health to broader society. So that's my first answer. We have, and we've always been a very credible sector. There's one survey even that, that asks which of the professions is the most credible and honest and trustworthy. And number 1 actually went to nurses. Number 2 are the doctors. And guess who are the ones at the bottom of the list? You can Google that Gallup survey. And so the health sector is already very credible, and that credibility even got boosted even further because of this crisis. So that's number one, use our voice to actually affect change. Number two, the health sector can also set a positive example. I mentioned a while ago that, we need to, I think, decarbonize our economies, our businesses. And the health sector is not an exception. We are 10% of the global economy, the health sector. And we also emit still carbon because we get our electricity from coal and not from solar panels. And we don't do green purchasing that much yet of medicines and syringes and all the materials we use for healthcare. So we can also, make our reduce the ecological footprint of our health systems. And again, that's also something that we can work on here in the country. How do we achieve universal high quality healthcare that does not pollute the planet and that is also ready for climate change and also ready for the next COVID?
And then we also have another question. How aware is the government about just the concept of planetary health?
Right. I think governments are aware, and government is a big word because it's, the bureaucrats on one hand and the politicians on the other. and so it's not a homogeneous group. But I think governments have an idea of these problems. But unfortunately, and again, it's, I think it's also by design, governments are fragmented. There's, if you notice, there's also very little policy coherence among ministries, among different departments, right? Whether it's COVID or in other things, because these sectors don't even talk within a large bureaucracy. But I think there's already a recognition that climate change is real, and that's going to be a problem in the future. Health is important, and that's why there are investments in universal healthcare, for example. But I think we need to start, creating a narrative where governments really appreciate how all of these are interconnected. That's one. We need to identify the bottlenecks that impede the translation of good intent to real impact, right? You talk to a politician, of course they love the environment, they want to improve people's health, but there's really a huge, no-do gap. How can we, close it? And perhaps there's a lot of role for businesses and civil society to nudge our governments to be more effective in affecting planetary health change in the long run. I hope COVID is a wake-up call.
Okay. Do we have any other questions from the audience? And then maybe Renzo, you can reiterate how they can get in touch with you just in case
All right.
they're still formulating the questions that they have now.
Right. So, you can take a photo of this screen. I have my details. Follow me on Twitter, and let's continue the conversation outside of the webinar. And again, I hope you're with me in achieving this. I think this is what, we can contribute not just to our people, the Philippines, but also to the world. I've mentioned to you already, the Philippines is at the heart of the planetary health crisis. But I believe in the ingenuity and the creativity and the energy of the Filipino in really affecting change, not just on a domestic, but also on a global, on a planetary scale. So, reach out to me if, you got stimulated by this presentation, and I would love to hear more of your insights. Thanks a lot again for this opportunity.
All right. So thank you, Renzo. And then I'd like to turn it over to our executive director here at IdeaSpace, Ms. Diane Eustaquio, for her closing remarks.
Thank you, Doc Renzo, and thank you to everyone. On your Zoom screen, you will notice down below reactions. You can give Doc Renzo a clap. Just that, and you could clap so he will know we're all clapping for him. Thank you very much for sharing with us your knowledge this precious 1 hour and how this can help all of us, all of the executives in the First Pacific group of companies, guide them in strategic decisions and also under, you know, even on our own personal lives, understand what's happening and hopefully share it with their family and their friends. Thank you very much for attending. Innovation Mornings is about diversity of thought, and having diversity of thought in our organizations will make us more innovative. So hoping that maybe you can give us topics that you would like us to tackle. Next month is going to be an interesting one. I'm really praying this executive is going to say yes, because it's going to be an interesting historic topic for the First Pacific group of companies and how we have survived the challenges in the past. So we will keep you posted. We're so happy also that we have representatives as far as Davao. When we were doing Innovation Mornings before, we have a limit of 25 people only, but today we have over 50 people who have signed up and said they want to join. So we're very happy we're able to have this reach. So there will be more of these, and hopefully with your feedback, we'll also continuously provide you with more interesting and thought-provoking discussions. Thank you very much on behalf of IdeaSpace. Thank you also for the support of all the donor companies. It is your money that keeps us alive and your money that helps the entrepreneurs of today and tomorrow that will be hopefully providing the donut, the businesses inside the donut. Thank you very much, everyone. Goodbye.
Remain safe. Thank
All right.
you.
Thank you, everyone. Stay safe and stay healthy. We'll be sending the link to the feedback form as well, so you can give us your input for this meeting and for any future topics that you want to be covered by Innovation Mornings. So again, thank you. Thank you, everyone. Have a good morning and enjoy the rest of the week. Enjoy your Wednesday and stay safe, stay healthy. Thank you.
Bye.